Hey peeps, it is November 19th, 2024, and this is a TikTok meant for women and the people who love them. I think it's really important that women begin to prepare to safeguard their own reproductive health as much as possible moving forward. If you're a woman of childbearing age, it's really essential that you proactively prepare yourself for what's to come and you take what measures you can to protect your reproductive health choices and your rights as much as possible before Trump is sworn into office on January 20th. So I wanted to outline some things for you to consider doing in the next 60 days. Number one, you've got to plan for your reproductive health needs moving forward. Whether you're in your 20s or you're in your 40s and still able to bear children or even older, whether you're in a relationship or not, you must seriously consider and protect your long-term reproductive health goals. And by long-term, I mean over the next 4 to 8 years. You should be planning and considering what are all the different components, what are the different things that I might need to do. The more proactive planning you can do, either for family planning purposes or for your own health, or literally to save your own life, the better off you're going to be. It's important for you to consider what method of contraception you will want to use, both in a long-term and short-term scenario. Long-term contraception will eventually be banned. It's only a matter of time, and it could happen very early on in a Trump presidency. So consider IUDs, consider hormonal implants as long-term protective measures that may support you over the next few years. If you are able to, stock up on an extended supply of contraception, whether it's the birth control pill or something else that could prove useful. Stock up on emergency contraception. Know what options you have in that regard and plan for a worst-case scenario. Even if you think this is not something you would ever need or use, I recommend that you still secure access to morning after pills like Plan B. These are usually good for 4 years. Even IUDs can often be inserted within a few days of having unprotected sex in order to help prevent pregnancy. But again, these may likely be banned and you may not have access to it down the road. So you want to stock up putting requests for these things now. Even now, they're going to be hard to get because you have many institutions for women and reproductive health places that are trying to stock up on this in the event that emergency contraception is banned. And women themselves individually are trying to stock up. But it's going to be even harder once these become illegal. So don't put yourself in that scenario and plan accordingly. Schedule a well woman visit with your healthcare provider before the end of the year. Even if you're not eligible with insurance, I would recommend you go in and do it. Discuss your options and work with your doctor to plan accordingly based on your needs and desires. Be cautious. Do not let a provider talk you out of proactively planning or securing long-term contraception or emergency contraception. This is your right at the moment. At the moment, you still have choice and you still have freedoms, and you have to be your own advocate. If you can't get what you need through a provider, consider mail order right now. That's still a legal option and you can obtain it without needing your doctor to approve. It's really, really important that you make a plan on how you will access maternal health services in the future, should you need them. Currently, given the ongoing abortion bans in various states and throughout the country, we are facing maternal health deserts in 1 out of every 3 counties in this country, which essentially means that women cannot find gynecologists and they can't find obstetricians to help support their maternal health needs. This may be you. So what you really need to think about is, how can I find these services in the future? Let me identify them. Will I be able to utilize them? Do I have to travel very far? Do I need to put money aside in the event I need to access these services? I have to pay for gas. I have to take off a day from work to visit a provider. Do I even have to leave my state? What will be your plan? You want to map that out. It's a good idea to review and update your health insurance. Examine your health insurance policy to ensure it covers the necessary reproductive health services. If coverage is lacking, you want to explore what options you have. But the other thing you need to be aware of is that in all likelihood, the Affordable Care Act, the ACA, otherwise known as Obamacare, will be repealed. Pregnancy may then be considered a pre-existing condition, which means that pregnancy will no longer be covered by your health insurance. So you have to think through, if you plan to become pregnant, how you will cover those expenses. And God forbid, you have a miscarriage or a medical complication and you need emergency services to save your life. What are you going to do? How are you going to get those services, and how are you going to pay for those services? Plan for the worst case scenarios in the event of a pregnancy. That means, what are you going to do if you miscarry and you are charged with child abuse? This is already happening in several red states before he's even taken office. It's incredibly important that you understand your state laws and research what civil liberty groups and resources are available to support you in the event that something horrible was to happen and you were charged. You want to be ready for worst case scenarios. The other more insidious angle, if you're pregnant and suffer an emergency, a medical emergency, hospitals in Texas are no longer required to save your life. Medically necessary abortions are no longer considered a viable option in many red states. This will likely become a situation, a scenario throughout the entire country once there's a federal abortion ban. So, very important that you understand state laws and your rights as they stand now, and you keep up with that. You should research hospitals and plan what you will do in the event you're turned away from hospital care multiple times. Again, do you need to put money aside to help you travel to a blue state or to get medical care that will actually save your life? Who will you go with? Who can you trust? You absolutely cannot wait until these things happen. You've got to think it through now. In the worst case scenarios, you're going to have to act quickly, and you don't want to have to spend time thinking and researching and making decisions. By making a plan now, knowing your trusted sources, where you will go, having money put aside, you are saving your own life, quite literally. This new administration could care less about your rights and your safety, and many, many women are going to die. Don't be one of them. Aside from planning for your own reproductive health plan moving forward, there are a number of other steps that you can do to protect yourself, secure your health records, and be an advocate for reproductive health rights. Follow me for part 2 to learn more about those things. But in the meantime, I just really wanted to emphasize that there will come a time in the very near future that your reproductive health, your freedom of choice, and unfortunately, potentially, your very own life will be in your own hands. Don't waste the opportunity to plan for the worst and be prepared. If you do, it's at your own peril. You want to use this moment to your benefit. Don't be a disbeliever. Take action, be proactive, protect yourself, and in doing so, you may be saving your own life, that of your children, and your future children.